Hello, good afternoon. Um, Thank you all for being here today. Today we have the next session of our Solid Talk series, and the topic of today is HIV/AIDS and drug consumption in Germany, Central Asia, and China, state of the art. And we are very happy to welcome Ingo Michels today to our series. Ingo has been working in this field for almost 40 years, and he has started in Bremen. He has worked for many years in Berlin, so he knows a lot about the HIV/AIDS situation in Germany. But not only, as you might know, he has also been working in China and in Kyrgyzstan, and today he will give us an overview and tell us more about the latest trends. So thank you all for being here, and the floor is yours.
So thank you very much for inviting me for this presentation today. And as already mentioned by Ulla, I have been working in the field for more than 40 years, started with the German AIDS Service Organization in Berlin at that time, 1987. And that was the situation where it was an increase, a very sharp increase of HIV infections among drug users in Germany. And so we started also with first programs on harm reduction. Later on, I will explain more in detail the situation. But now I wanted to check. Yeah, the next slide. This is the strategic background information in Germany. There had been a strategy on dealing with HIV and AIDS, organized by the Ministry of Health and the Ministry of International Development. And that time I was also working in the ministry, and 2016, and I was able to look for this strategy. And it's also based on the regional action plans of WHO, which is responsible for the region, not only Western European countries, but also Eastern European countries, and also Federation of Russian Federation, and also Central Asian countries. I will go to this later on and explain a little more. And in 2020, we had the opportunity to work in the Kyrgyz Republic together with our colleagues in Tajikistan and also in Kazakhstan to look what is the situation of HIV and AIDS in these countries, and what can we learn about this, what kind of information are needed for prevention of HIV and AIDS, and what can we do in cooperation. And this is the overview on the situation now with data from UNAIDS, this joint program of the United Nations. By the way, the new overall background office is no longer in Geneva, but in Bonn, in the city where I'm living, the former capital of Germany. And here also the UNAIDS has now the headquarter, and that means they are looking for collecting data, but they're also working on strategies. And what we find here is the global HIV situation. We are now facing the situation that more than 40 million people have been infected with HIV, and a lot of them had already died because of AIDS. And in the situation in the Central Asian countries, a little bit different. We have also this situation of HIV infection among the whole population and more specific groups, and also new infections. And we have the new situation that in Central Asian countries, there is still an increase of infection with HIV/AIDS, whereas in Western European countries, there is a decrease. And more or less, the situation is, how to say, we have the situation that we can deal with HIV and AIDS. This is the situation in Germany. And what we find here is, on the one hand, there's a decrease of HIV among drug users, a slight increase in the last 2 years. But most of the people who are affected are people, men having sex with men. On the other hand, we have, as you see here, PrEP, the new preparation, the new medication for preventing HIV. It's used in Germany mostly by men having sex with men. And what you see also, there are infection diseases, sexual diseases, and that means that this men having sex with men are actually sexually uh, very active. So they use PrEP to not to use condoms and to have not to be infected with HIV. This is the overall situation concerning the goals of the WHO and UNAIDS to stop with HIV at the 2030. And there's this so-called cascade. 90% of those who people who might be infected should know about the infection. 90% of those who had been diagnosed with HIV should be, no, those 90% of them should be diagnosed, and 90% of those who are diagnosed should be also treated with medication. And most of them should also have positive effects of this medication. And here you see the cascade for Germany. Nearly 80% of those who might be get infected with HIV have the diagnosis. More than 80% of them are treated with our antivirus medication. And even about 90% of those are treated positively and effectively. And we have got this information by the European Center of Disease Control, which is working in Stockholm for this whole region. And that shows that in this midterm review, it shows that the impact of the strategy had been positively effective in Germany concerning at least HIV. It differs for hepatitis C, but for HIV, it's quite positive. On the other hand, we have the situation, especially here, some information by Lancet, this very important uh, publication, and in the current issue in January, it shows the situation, the global situation is not the best one. HIV prevention is not on track. That means it will not be finished in 2013. And especially in Southeast Asia, it is still a big problem, but also in Central Asian countries. Here are the data for Central Asian countries, and we have still a quite high prevalence in Kazakhstan, with estimating HIV prevalence among the total population of about 77%. And also in Tajikistan, it's even higher with 9%, but it's mostly very high. It's still very high in the Kyrgyz Republic, with 18% in the HIV prevalence in the total population. It's quite low percentage in Uzbekistan, but later on we have to discuss whether this data is really reliable. I'm doubt a little bit about it, but at least concerning that Uzbekistan has the biggest population, it might be the situation also that HIV prevalence is more or less under control. Here is the data is and you can look to have a data to this surveillance publication by the WHO and the ECDC in Stockholm, and you see here also they're covering the whole Western European countries, but also Eastern European countries, and such as Ukraine, such as Belarus, the Russian Federation, but also Central Asian countries. They all send the data to this center in Stockholm, and this data is provided and giving some advice what to do to reach the goal. And here are some information about, this still there's still the so-called northern route for trafficking opiates from Afghanistan through Central Asia to Russian Federation and even to Eastern European countries. There is now, since 2 years, a ban by the Taliban regime in Afghanistan to stop opiate trafficking. And this might but there's still some some stocks of heroin, but maybe in 2, 3 years it will be difficult to get heroin from Afghanistan any longer. And there's also we know, on the other hand, now we have more than so-called new psychoactive substances like methadone and some others, which are provided in all Central Asian countries. And there's a big increase, sharp increase in the last years, also in China concerning these substances. And there was the fear that also methamphetamine will be increasing in Central Asian countries, and that's why the cut up the Central Asian Drug Action Programs by the European Union, and we have been part with our university, or the Frankfurt University, some years ago, and I have been working for this program several years in Central Asian countries, and we did a survey organized by Ulla and some other colleagues to look for the situation in Central Asian countries. Also, Kasha Kowalski was working together with you, with the expert from Central Asian countries, and what they found is that there is no signs that methamphetamines will play a bigger role in the Central Asian countries. But other NPS, so-called new active substances, they do play a bad role. Here are some information also by this CADA project. Unfortunately, we got this data not after 2017. That is the latest data which had been provided and published by the SCADA project. But what you see, and the trend is going on, there is the prevalence of drug users in the narcological registers is decreasing in all the years. So that is a sign that maybe heroin use and opiate use is decreasing in all Central Asian countries, and also the newly registered, and that might have consequences also for HIV prevention, of course. And here is the data which we got concerning the opiate substitution treatment, or so-called now opioid agonist treatment in Central Asian countries. And I will later on give a more detailed information about this. Until 2017, there was the increase, especially in Kazakhstan and Tajikistan, and there was a quite high percentage of opiate substitution treatment in the Kyrgyz Republic, which started very early with this treatment. But unfortunately, in all these Central Asian countries, this is the last 2 years is a decrease of substitution treatment. And this is some data. It's organized in a publication by a Kyrgyz woman. She's working in the University of Bremen. I think she's still there, working there. And she organized some information about HIV in Central Asian countries. And you see also quite high population in Tajikistan firstly, but later on it was mainly Kazakhstan who had got this problem, where it had been decreasing in Uzbekistan and also in the Kyrgyz Republic. But it's still a quite high percentage of people with HIV infection in all these countries. Here is another information about from ECDC, and it shows a little bit situation in all Western European countries, in the European region, also in Eastern European countries, and it shows quite well, especially there is an increase of heterosexual contacts leading to HIV infections, whereas injecting drug use is decreasing and the number of people who had been infected because of injecting drug use is decreasing. And mainly because of instruments of prevention. That means syringes, provision of clean syringes and needles, which is done in all Central Asian countries, and also substitution treatment. Here, and it is important to know this because it's still the situation that the highest percentage of people who are infected with HIV are infected because using contaminated syringes. And that's why injecting drug users are still the most risky population to get infected with HIV. Of course, there are some changes. That means injecting is decreasing, smoking heroin is increasing, but of course it depends whether this heroin has a good quality. And this is also not the situation, no longer the situation as it was 10 years before. where you got very, very pure heroin, especially in the border region to Tajikistan from Afghanistan, and later on also in other Central Asian countries. So this is the situation now. This is data from UNAIDS from 2024, the latest data which have been published, and it's the situation in Kazakhstan. And here is also, and Kazakhstan is the only country in Central Asian region which is providing information about men having sex with men. And they're estimating about 70,000 people. I don't know how this estimation is working. It's still difficult to get all this information. And they also have the idea that about 80,000 people inject drugs. Also, this data is, there had been more than 120,000 in drug users estimated in Central Asia, in Kazakhstan, when I had been starting to work there 2010. But this data and this information has changed significantly, and now only, I think they're estimating now 60, 70,000 here, you see, and but a lot of people are injecting still. Um, but anyway, the looking this the cascade also in Kazakhstan, those who have been diagnosed with HIV are treated also. Most of them get the treatment, and as far as I know, this treatment is also not only paid by international organization, but by the Kazakh government as well. And also, HIV prevention is working in a lot of AIDS centers in Kazakhstan and also organizations of people living with HIV. They in all the big cities in Kazakhstan, there have been these NGOs working, and they're providing also syringes and clean needles and information about not to be infected with HIV. And anyway, there is an increase, especially in the heterosexual population in Kazakhstan, whereas it is a decrease in people using substances and also in the group of sex workers and also with men having sex with men and even inmates. But here you see and this is an information by dissertation in the last solid period by Dalida Mukasheva. She is now working also as postdoc in our project, and she had been working on the health and social welfare situation in prisons, especially concerning women with HIV and the role of social workers in the prison system. And what you see in her dissertation, she showed that especially among women in women in prisons in Kazakhstan, there's a very high percentage of HIV infections, mainly because most of these women are incarcerated because they're using drugs and substances, and that's why they are in prison. And most of them, or a very high percentage, have a positive HIV status, and also more than three-thirds hepatitis C. And even viral hepatitis B is quite high, whereas tuberculosis is relatively low. But anyway, it seems to be that they infected with tuberculosis within the prison system. This is also a challenge. Here is the data from the Kyrgyz Republic, and it shows that at least in the Kyrgyz Republic, there are also estimation of sex workers. I don't know how they do it, but they think that in Kyrgyz Republic there are about 13,000 sex workers. There's no estimation of men having sex with men, and this is because there's a big discrimination of people, of men having sex with men. It's not forbidden, but it's very discriminated, and that's why they don't have reliable data on the number of people and also how many of them have been infected. But there's good estimation and data by the AIDS centers of those who are infected with HIV. And what you see here, also here is still quite high prevalence of HIV among the total population and also among drug users. But this is decreasing. And you see, it's significantly decreasing and reducing because of this HIV infection prevention work, syringes provided even in the prison in Kyrgyzstan, and the same is true for Tajikistan. And also, antivirus therapy is provided. So we have a sharp decrease of infected drug users in the Kyrgyz Republic. And also because of the methadone pre-treatment. And here you see the number of new cases among drug users is very much decreasing in the Kyrgyz Republic. And we hope that this will be continued in the next years. But we will see, because that sharp decrease of uh, money which had been provided by US aid and USAID and by the US government. So it has been a sharp decrease, and also CDC, which is working in not only in the United States but also in Central Asian countries, and had been responsible for dealing with HIV prevention work. They will not continue with their work because of the budget has been, yeah, shut. This is the situation in Tajikistan. As already mentioned, they have a quite high percentage of people with HIV, but they have also quite in implementing HIV prevention work and also substitution treatment with methadone. And so it's still, but as you see here, it's a quite high population in prison. And it was in Kyrgyzstan and also Kazakhstan, the number of prisoners has decreased in the last 2, 3, 5 years because of some reform projects. But in Tajikistan, it's still more than mostly 300,000 people in prison. And I've been working in Tajikistan also with the Kara project, and I had also visited the prison in Dushanbe, the biggest prison in Dushanbe, and they're also providing syringes because they know about the HIV infection. They know that 60% of the inmates are drug users and still continue to use substances in the prison system, so they're providing syringes in this prison at least. And this is the situation in Uzbekistan, as already mentioned. I'm not quite sure how reliable this data is, and you see not much data is provided even by the government to UNAIDS. They don't really exactly know what is going on. What you see also, these are some data which we got, and we also provided in our NAMOS book last year, or 2024, in coordination with the International AIDS Conference in Munich. And in this book, Aziz Bekboltayev had been working on this, giving some information about the situation in Uzbekistan. And what he shows is concerning the cascade, there much money, many of HIV testing is done in Uzbekistan, and those who got HIV infected got treatment. But what you see also in this data is the treatment percentage, those who are is not so much affected. We don't know. I don't know exactly why. On the other hand, what is going on in the situation is the same, I think, in Tajikistan, it Kyrgyzstan, maybe not so much in Kazakhstan, is people who are working as migrants in the Russian Federation to earn money for the families. They got, of course, a big problem also to get infected with HIV, especially because when they are sexually active in the Russian Federation, without the families, without the women, the husbands doing also sex work. So not that sex work, they have sexual activities and using sex workers for this, and that of course might be also a reason why they get infected with HIV. So this is still a big challenge for these countries. And here's an overview concerning the results of whether the targets of UNAIDS and US WHO are met. And what you see here, mostly in red, there is big problems in all Central Asian countries because of discrimination and, of course, especially of criminalization, especially for sex work and drug using. Most of this is criminalized. And this situation is also in Uzbekistan. In the other Central Asian countries, homosexual activities are not forbidden, but they are not they're discriminated, but not forbidden, not prohibited. But in Uzbekistan, they are prohibited. And this is also a big challenge for HIV prevention among this group. Um, concerning the situation in China, I've been working and living in China also in another project in 2006, 2008. And China is also had big problems with opiates and many, not from Afghanistan, only a few. There's uh, in the western province, northwestern province, Xinjiang province in China, had been a big infection disease among in drug users in this region, and they got their opiates from Afghanistan. But most opiates are coming from Myanmar to the richest big cities at the eastern coast of China and also in Beijing. But the situation has changed in the last 10 years. Mostly methamphetamines and ketamine is the most those substances which are used more and more, whereas heroin is going down and decreasing as well. So this is the data which we got from our Chinese colleagues and from some publications about this. And we have also a sharp increase in the first years in China in 1985 and later on. And what you see here in the green picture color shows the number of drug users concerning these infection. And what you see is this is going down, 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 and decreasing more and more and more. And now the same situation in China as in others in the Central Asian countries, that the heterosexual community is mostly affected by HIV, and in this group, especially also women, whereas drug users is decreasing, and also men having sex with men. There's, of course, a high percentage would get infected also. And in China, they started also with programs to eliminate this, and they started also with no with very effective programs to deal with this disease, and also the providing antiviral treatment to mostly all of those who are affected. And this data we got from our colleagues in the SOLID project, and also this shows that in China we have about more than 1,400,000 people active with HIV, infected with HIV, but now a lot of them had been already died of this. And now a current situation is, in this last year, we got about 760,000 HIV infected individuals and 620,000 AIDS patients. So more than 1 million affected people, and half of them with AIDS. That means they get medication, but it's very difficult to help them not to die because of HIV. In Germany, it's only a very small percentage of those. We are now estimating 100,000 people with HIV infected. Currently, maybe about 20, 30,000, and only very few people got AIDS now because of medication which are very potent and helped people not to get infected, not to get AIDS, but infection. And also the problem is to get more and more of them get hepatitis C infection, especially among injecting drug users and sex workers. This is an overview on the development, very few years, uh, started in some provinces in the western part of China, and then more or less old Chinese provinces had been infected with HIV. And here is the latest data from China. We got data from 2023. I don't know why we don't have new data from China, because normally they give this information also to international organizations. But this is the latest data we get from China, and that shows that nearly all of them who had been diagnosed with HIV get also treatment for HIV. And so this is working out. And on the other hand, this is the situation concerning HIV among injecting drug users. And what we know, as already mentioned, there has been a very sharp increase of injecting drug users in China. When I was there, 2004, there had been an estimation that even 3 to 4 or 5 million people using heroin. Now this number has decreased. There are now maybe 1 million or even lower percent people who are using opiates. But what you see also is that there had been a sharp increase of methadone treatment centers. When I worked in Shanghai, 2004 to 2006, there had been the first pilot projects. And after 2000, when I started to go back to Germany, a very sharp increase of centers for methadone treatment in clinics. And you see here now, all over China, in nearly all of the provinces, we do have clinics for HIV, for methadone treatment, but also HIV, AIDS centers. And that means that we now have more than 760 um, methadone treatment centers and about 160,000 people in treatment. But this number has decreased. It has been some years ago more than 200,000 in treatment. Now we are estimating 160, maybe even lower. And also when we have been in Shanghai 2024 with our project, they told us that also the number of methadone treatment has people in treatment has decreased in the last years. We don't know exactly why. One of the reasons might be that there are treatment offers all over China, but there's a quite low rate of effective methadone, and it's much lower than which is provided in Western European countries, and that might be one of the reasons why maintenance in treatment is not guaranteed. On the other hand, they have very positive effects of HIV infection. This had been decreasing very much, and you see that has been discussed, and we got this information by our Chinese colleagues from Shanghai Mental Health Center. They said that the infections among their patients is very, very low, under 1%. So that is quite positive effects of methadone treatment in China, which is a very important component for HIV prevention. And also more or less all of people who got infected are treated with methadone with antiviral medication. And this is a decree from 2006 by the State Council of in March 2006, and it is still working. And in this decree, it says no one should be discriminated against. There should not be discrimination against people affected by HIV and AIDS, and not also these people, but also not their families, and they should get the protecting of their rights. That means right to marriage, right to work, access to medical treatment, and to education. And also it says by this decree that should be provided behavioral interventions and treatment to vulnerable groups at high risk of HIV infection and to support these people. And this is done. And of course, China is a very big country, but at least when we had been working and when we had been in China, in Shanghai, at least they could provide us with several information about HIV infection prevention work in China and in Shanghai, and it's working quite well. Here you see this is the information about one of the methadone clinic in Shanghai. When we had been there in April 2024, some of them, I don't know who of us had been with us, but anyway, they showed us one of this outpatient clinic in one area of Shanghai where many normal people are living. Nobody knows, or they know that there are people, drug users who got treatment, and there's no discrimination, and it's quite within the normal population center. And what you see on the right picture, on the right side, that was 2006 or 2004 when I was there. There was the methadone treatment by this pushing the methadone for the clients from this bottle. But now, in the left side, this is the newest data. And now it's everything is China is very quick in even quicker than in Germany with this kind of technology. This they showed us this technology, new technology. That means that all the patients are the data of all the patient is known in all, not only in China, in Shanghai, but all over China. In Germany, this is not possible because we have this data um, um, protection laws, and that means that data from drug users are not given nor to the police nor to other centers. It's very difficult to get this information, and so if drug user is traveling from Hamburg to Berlin, it might be difficult. He will be get methadone also in Berlin, but he or she might get special information for the doctors in Berlin then. In in China, it's different. When you go, when drug users, patients want to go from Shanghai to Beijing, they can go, and in Beijing they have got all this information already, and the treatment will be continued. So this is the positive side. The negative side is all data is not only available all over China, but also by the police. And if this one of the people is continuing with heroin use, immediately he will be back in the prison and also in the compulsory treatment center. In Germany, it's a little bit different, and there's at least they will get more support then. But also in Shanghai, we also discussed in Shanghai with the mental health center and also with social workers there, and there's a very big good information, and social workers are looking for these people and help them to get, how to say, back to the society, get a job, get a shelter, and get more information about, and also get medicine. So this is the situation in Central Asian countries. And here are some pictures for several years, I think 20, 30 years ago. They started already in the most affected provinces in the western part of China with these outreach workers, social workers, or people who did it by their own. They went to the city, to some parts of the city where drug users are living, and provided them with syringes. And even here, this guy with a bicycle went with syringes to all over the city to provide the syringes to drug users. And they get also information and medication in their uh, public health centers. So, as you might know, we in our project in 2024 provided this book and worked on this book, and all of them, all our partners in all Central Asian countries and in China, which are part of our project, had been working on this very important book, which gives a very good overview on the HIV and hepatitis C situation in our partnering countries. So if you're not already got this book, you can also you get it. You can download this information, and to get all this information, unfortunately, only in English. Maybe we might have the opportunity to translate it into Russian, or you can do it by your own. But anyway, also this is a very good background information about HIV and AIDS in Central Asian countries and in China. This already showed you. Oh, sorry, the wrong direction. Yeah, these are the last slides. In 2024, we had the opportunity to visit the International AIDS conference, which had been held in Munich, and there was a special stand by the German government, as we had good cooperation, good contact connection with the Ministry of Health and the government. We had been able to use this stand and this booth to with our project, and we had the opportunity that all the people who went with us to this conference informed the public on the situation in Central Asian countries. So there had been presentation by Hang Su from Mental Health Center in China, and also by Nurgul Musayeva from the Kyrgyz Republic, by Dinara Yasimova, she provided information about Kazakhstan, and also Amir from the situation in Uzbekistan. and also we got information about Tajikistan. So thank you very much for listening to my presentation. And please, if you have questions or critical aspects, yeah, don't be shy and ask me. Or thank you very much again.
Thank you very much, Ingo Ilja. This was really a very nice presentation. It gave us a comprehensive overview, and also I liked it how you made it very palpable by showing all these pictures and sharing some of your stories. So I think we really have some state-of-the-art knowledge at this moment, and yeah, it's I think it will be nice to have also reaction from the region, and for this I would like to hand over the floor to Aisuluu Shailoobek, who is our scientific coordinator of the SOLID project in Bishkek, Kyrgyzstan. And Aisuluu has also been working on the topic of HIV/AIDS from a social work perspective. So I would like to invite you, Aisuluu, to share some of your thoughts about this with us. Thank you.
Thank you very much. Thank you very much, Ingo Michels. Presentation was very interesting. I want to add some information about Kyrgyzstan. Today in Kyrgyzstan, there are more than 15,000 people living with HIV. And it's important to note that main way of transmission now is sexual contact. In the past, HIV was more often linked to drug use, but unfortunately, the situation has changed. About HIV prevention in Kyrgyzstan, includes several key areas like first, public information and education. A campaign are being conducted to raise awarenesses about HIV transmission routes and methods of protection. Second area is HIV testing, plays also an important role. People get tested for free and find out their status, their status. Third is harm reduction programs for people who use drugs and another key population. It includes needle exchange, access to substitution therapy, Ayurvedic therapy, and psychologists and other specialist consultation. And also regarding HIV prevention in penitentiary system, despite of close of Atlantis Center, rehabilitation and adaptation center has been opened in its place, and all of prevention certainly prisoners can take in this rehabilitation, like Ayurvedic therapy and other services. About our problems, also NGO plays a crucial role in prevention. They provide services for key population, including prevention and social support. But the problem that they have temporary project-based support available only while project is running. And now they face challenges about limited source. It's our and another challenges and problems depends with stigma. Stigma is one of the key problems that we discussed today, that you mentioned. And Kyrgyzstan people living with HIV, as well people who use drugs, often face with judgment, fears of disclosing their status, and discrimination. And it's directly affects their willingness to seek help. And also we have a problem with new psychoactive substance. New psychoactive substance use mainly new generation. It's also we have a problem with it. And I think social workers in this area, they play a very important role. Social workers provide social support, psychosocial support, help people access medical, social services. They work with their families and communities, and they also work with problems like a stigma and something like that.
Yeah.
That's all. If you have a question, I can answer.
And just thank you very much for this information. And it was also interesting when you look to your your dissertation, because you did a survey among students and those of social work and social workers. And I was also interested in this dissertation, and you showed that there's still not 100% knowledge of HIV even among social workers and even those who work in this field. And that was also astonishing. But we did the same, not a survey, but when there was a meeting in Frankfurt, I think some years ago in this Solid project, we asked the German students about their information about HIV, and we found also quite high percentage of people that did not know about. And they even had the idea, oh, you got HIV via mosquitoes, something like this. And this was very astonishing that also social workers and those people who are educating and studying social work had the same ideas and about infection in your study. That was so interesting.
Yes, we have a problem because social workers from government not work with HIV people
Yeah,
mostly.
yeah.
That's a big problem, and that's why the people living with HIV like to go to NGOs. They don't like government organization because they afraid the stigma and something like that.
Mm.
And before Solid, social workers in universities, they will not have enough information, and don't have special subjects for training how to work with people with HIV and how to work with prisoners. And I think now situation is changed because in our university we teach, some universities also start to include some theme about HIV. But it's also thanks for your project. But even about transmission, our social workers and social work students don't have enough information about transmission. About they think that through the kiss, HIV can transmission can заразиться, and it's very sad.
Yeah.
But we are working in these areas.
Thank you. Now I would like to give the floor to our participants. Maybe there's someone who would like to ask a question, either to Ingo, Ilja or to Aisuluu. That could be also a PhD student or, yeah. Maybe you would like to clarify something or you have something else to share. Any questions are welcome. You can directly ask or you can write your question in the chat.
Yeah, hi again. Can I ask a question?
Yes.
Yes.
Thank you very much, Ingo, for a very interesting presentation, especially with the data, because those are not actually that much available, except the Solid actually was kind of publishing, Solid participants publishing, but other than that, it's very difficult to get those information. So thank you so much. And thank you, Aisuluu, for overview about Kyrgyzstani case. So my question is to you, Ingo. We know about the roles of NGOs in Central Asian countries. Those are the very key kind of players, right? So my question would be, what is the role of NGOs and community-based organizations play in supporting HIV prevention, treatment, and methadone services in China? Because we kind of have little information about that. And for me, who is interested in the third sector, would be very interesting to know whether the NGOs are active in China as it is in Central Asian countries.
Yes, I think it's still not the same, but more or less the same as in Central Asian countries. First of all, at least it depends. We have been working or visiting Shanghai Mental Health Center, and Shanghai is not whole China. The situation in in other parts of China might be different, but in Shanghai, they have a broad information about HIV/AIDS. They have social worker, they have public health centers all over the city, and the HIV prevention plays a quite high importance. They're providing syringes. They have a quite good methadone program. I gave you some of this information, and this is not only in Shanghai but all over China. You will get this both information but also methadone for treatment and also medication, other medication for those who are infected with HIV. They got this information provided and without charging them. So it's free of charge for them. And that's a great opportunity. And that's why they have been decreasing HIV among China, more or less, not 100%, but quite a lot. And it started very early. As I said, when I lived in China 2004, there had been already some big information leaflets and in the television, and that was also very important. The television, the leader at the time, Deng Xiaoping, it was the 1st of December, which is the World AIDS Day. He in the television he went together with people infected with HIV and shake hand with them, and that was very important part of anti-discrimination to show that even the highest guy in China, the leader shake hand with infected people, and so he shows you will not get infection if you shake hands with people or uh, give. This was very important message. On the other hand, also from the first of beginning, China, the government worked together with UNAIDS and also with experts from Australia. And those people, the expert from Australia, convinced the government to start with methadone treatment, to start with syringes exchange and providing syringes and also information. But because at that time also there was not only discrimination, but there was also fears how to get infected. And most of the people in China, for example, had the idea if you use chopsticks when eating, you be infected to use the same chopstick as the people who are infected with HIV. Something like this myth had been provided, and that's why the state started with propaganda information about HIV and reliable information. That helps very much to reduce the stigma. Anyway, of course, also in China, there is still stigmatization, still discrimination, because Shanghai is a very modern city. Yeah, it's even the standards, it's high quality standards in all over Shanghai and information you will get. So it's different from rural areas in China and people who are not so much educated. Of course, there's also some myths about HIV infection, but mostly it has been quite successful done to provide this information. And now in China, there are more than, I think, 350 or 400 universities educating social workers. They have more than, I think, 200,000 social workers working in the field. But of course, as already mentioned by Aisuluu, also in China, only a very small percentage of social workers work with people in drug users or with prisoners. So this is still a challenge also in China. But they have, at least in the big cities, they have quite well informed a network of social workers and public health centers which are providing this information, which are fighting for rights for people with HIV, and this decree which I mentioned is still working. So at least there is officially, we don't know exactly what is the situation all over China, but it seems to be working quite well. And I hope that we also continue, because the Kyrgyz Republic was also the first country in Central Asia with starting with these kinds of information very early, and also invited drug users in organization or NGOs to be part of this. And I hope that will be continued. Anyway, I don't know whether it will be continued, because most of these NGOs in all Central Asian countries had been financed by international organizations and or by USAID, and this had stopped. So I don't know how it is continued in your countries, this working of NGOs. Maybe Aisuluu or Jarkin knows a little bit more about the situation of NGOs, also in Dinara, what is going on in Kazakhstan, because if most of them are working voluntarily, but if they don't get any money for support, it will be difficult to continue this information and this work. Uh, there are 8 centers, and I think in all Central Asian countries, at least the 8 centers and the people working in 8 centers, which I met, very, very open people, very open-minded, very effective in their work. They did the best that they can do. But I don't know whether they will get money in the next years. We know the situation even in Germany. There will be cuts of giving money for aid centers. They are still getting a lot of money, but in the next years there might be also cuts in their budgets, and we don't know whether this kind of working for HIV prevention will be continued. We hope very much, but we don't know.
Thank you.
Thank you. I also have a question, Ingo, Ilja. You mentioned that in China, quite high percentage of people living with HIV actually develop the last stage of the infection, AIDS. And you also told us that in Germany, this is very rarely the case, because people have very effective treatment, and then it doesn't reach to this last stage. How is it in China? What is the coverage? I mean, how many people who are infected actually receive treatment?
Yes, as I already mentioned, I got this latest information by a colleague from Shanghai Mental Health Center, and they said we have about now 1 million people living with HIV in China, and half of them, about 40% might be get into the stage of AIDS. I know, but it's also not quite clear. AIDS does not mean any longer that you will die. When I started to work in the field, 1987, nearly 8 of my colleagues in the first year when I worked in the German AIDS Center got infected with HIV, and at least only 6 months later they died, all of them. So at that time it was clear, if you get an HIV infection information, that means you have only 1/2 a year to live. And this has changed dramatically. So even now, if you get some AIDS, it also means many kind of diseases, infections, and illnesses. Not all of them will lead to death. And at least now is very much good information and good medication. At least in Bonn, there's a university, the center, and university clinic, which is doing quite well. I know it quite well because my wife is also for the Working AIDS Service organization in the city, and she has a very good cooperation with the university clinic, and they're doing quite well work. So nobody will get full-blown AIDS no longer, and most of the people HIV infected have a quite normal living situation. but I don't know exactly what is going on in China. I got this information. We have maybe in the next meetings, if you meet with the Chinese colleagues in Almaty, in Astana, please try to get some information how they explain this, because of course the situation in big cities quite well, also the clinics there, but and maybe in rural areas it's difficult or different, but I don't know exactly how many people will at least already die by AIDS from AIDS. This number has also decreased in China in the last years, but the exact data I don't know. I got this information, but not background information what is going on. But as far as I know, at least in the big cities, the treatment is quite well, and also medication is free of charge and is working as well quite well. They're using the same medication in China than in other Western European countries, and this medication is working as well.
Okay. Yeah, thank you very much. I think it was really a fascinating talk. So we had really a good overview of the HIV and hepatitis situation. Now, a last round of questions. Is there anyone who would like to ask something more? A short question, is there possible? Okay, so if this is not the case, I will stop the recording